This is called Soothanol. Soothanol is excellent for sore muscles. You can get this on the web. If you have any problem getting it, contact us at the office. If you have any problem finding out more about that vitamin D3 and the 5,000 unit dosage. By the way, I want to point out, vitamin D3 is not entirely safe. You have to know what you're doing. I gave the parameters. I simply told you how I did it. I'm not telling anybody to do anything. You do not become a patient of mine by watching this program. Hopefully you become educated and then you can address this issue with your physician. But I'm not telling people to go on 5,000 units of vitamin D3 for 30 days and then take it 5 days a week. I told you that's how I do it with only some of my patients, because some of my patients don't need any vitamin D3, and if they took that much vitamin D3, they would become D3 intoxicated. Well, this is magnesium. Most people are very low in magnesium, and this has been shown, taking magnesium has been shown to prevent a little bit the future development of diabetes in children. I hope I'm saying that correct, but I believe that to be the case. If anybody developed, if we got the flu season, which suddenly seems to hit, I got 5 calls, if I got 1 call today, about aches and pains all over, nasal congestion, sore throat, swollen glands, feeling terrible, headache. That's sort of the flu-like picture. I believe that this increases immune strength. It's called Empower, and the actual chemical name is AHCC. Now that stands for Activated Hexose Correlated Compound, but AHCC is a good immune stimulant that I recommend. Okay, now, here's some medical articles that I want to go through. People always worry about, is my blood pressure higher in my right arm or my left arm? Somebody finally did a study, and they found out that it actually is a little higher in the right arm, but not remarkably different. Here is a study that shows the association of hemoglobin A1C with the severity of coronary artery disease. Now, this is a point that I cannot make strongly enough. The hemoglobin A1C is a measure of your tendency to become diabetic. You want your hemoglobin A1C to be less than 5.5. And how do you do that? Yes, an unprocessed whole foods diet of brown rice, vegetables, beans, fruit, fish once or twice a week, and that's pretty much it, would be the best way to go about it. However, once you get to a certain age, which is generally around 35, you must have some exercise to go with it. So you need to exercise and follow an unprocessed whole foods diet. But this correlates, the higher this hemoglobin A1C, the more hardening of the arteries a person develops, the more severe that hardening of the arteries is. And what that says is poor sugar control accelerates the hardening of the arteries. Now, what you want to think of is sugar like being a roasting agent. That is, the more sugar that you have going through your blood vessels, the more it's roasting everything it comes in contact with. The blood vessels in the eyes, the blood vessels in the kidneys, the blood vessels in the heart muscle, and so those tissues get roasted, and one develops cardiomyopathy, which is an abnormal function of the heart. You develop kidney failure or renal disease, which goes on to dialysis. You develop retinal disease, which leads to blindness, and that's due to the higher sugar. And the lower your sugar, your sugars should sort of always be right around 90. The American Diabetic Association talks about values up to 126 when you're fasting and up to 140 after you've had a meal. I like to see all sugars be closer to 90 before or at 90 minutes after you've had your blood sugar. You have to move there gradually, but getting that gets that A1C down to less than 5.5. Now, a lot of people are taking Preventive, Prilosec, Nexium, Protonix on a daily basis. Long-term use of those compounds is associated with an increased risk of fracture of the hip. And the point being that we're supposed to have acid in our stomach, and those medicines, Prilosec, Nexium, Preventive, Protonix, they vastly reduce acid production in the stomach, which may be necessary to control your acid reflux, etc., but there are some natural things that you can also do to control your acid production. Here is an article on, let's see, yes, xanthine oxidase. Uric acid is one of the future predictors of who will have high blood pressure, and also I met a very famous surgeon from Minnesota at the American College of Cardiology a number of years ago. His name is W. Dudley Johnson. I don't know if he's still operating, but he was doing like more of these coronary artery bypass surgeries than virtually anyone else in the United States. And he said he would not operate on a patient who was not taking allopurinol. And what allopurinol does is it inhibits the enzyme xanthine oxidase. It lowers the uric acid. That's what it actually does. Some people believe that uric acid is good, and some people believe it's bad. I tend to think that a lower uric acid is good, but I will say this, people with very low uric acids, and I'm not telling you to do what you need to raise it, but people with very low uric acids tend to have cancer in the family, and so that may be a marker of increased risk for cancer of various types. I'm not saying that you don't want your uric acid low. Uric acid, like I said, predisposes to high blood pressure, and that's a very strong cause of future heart attack, heart failure, kidney disease, and stroke. Here's an article about the use of antioxidants actually increasing your risk. And I generally say this is a case of the computer rule. Garbage in, garbage out. Ask the wrong question, get the wrong answer. The antioxidants that are generally used in these are not in their natural form. And that's one of the reasons why I have routinely recommended the Mega Foods brand, but also there are others that are fairly similar, although I don't believe they're quite as good. Natrol is one, Rainbow Light is another, and Nature something or other is also more food extracted. In other words, Mega Food is a company that actually extracts the vitamins from living plant substances. You may think that it's not good, but they take yeast. Yeast will make these vitamins, and so they make them in the proper form with what are called their chaperones. And chaperones are these other little things that come with the vitamin. For instance, vitamin E, and I'm sure I've talked about this many times. Vitamin E is not just D-alpha tocopherol. Vitamin E is 8 components, 4 tocopherols, 4 tocotrienols. And you need all 8 of those components in order to have proper vitamin E. Well, that's what you get when you make it be produced by these yeast because they can only produce it in its natural form. They don't produce it in its chemical and synthetic form.